Dr. Fatima Kakar is a pediatric infectious diseases specialist in Montreal. Dr. Isaac Bogoch joins us from Toronto. You know them both. Doctors, when we hear descriptions of hospitals under strain, can you put this in some perspective for us, Dr. Kakar?
Yes, and to be honest, I've never seen our pediatric hospital so full and so full of children with severe infections, complications from the flu. Every bed is occupied, every bed is precious, and the lineups in Emerge waiting to get in are huge. So the system is under strain, but I've never seen such significant infections and such severity of infections since I've been a physician.
Dr. Bogoch, does that echo what you're seeing too?
Not entirely. I mean, certainly the adult healthcare system is stretched, and it has been for some time. And the degree of how much it's been stretched has sort of ebbed and flowed throughout the pandemic and, of course, into the influenza season. I think there's certainly tough times ahead, and it's certainly challenging right now. But compared to how significant the issues are in the pediatric world, I would say that the adult healthcare system, while stretched, is not stretched as far as they are in the peds.
Okay, so the focus on kids right now, and I suppose, Dr. Kakar, the question then is how does this compare with what happened to kids during COVID? I mean, in terms of what you're seeing, what sort of symptoms and effects?
There's actually no comparison. So influenza right now is much more severe than anything we've seen from COVID, any complications from COVID, just in terms of sheer hospitalization numbers and in severity, and actually even more severe than what we've seen with RSV. The difference with influenza is what happens after you get it. The week or two after, you can get severe complicated infections requiring ICU support, needing surgery, long-term hospitalizations, which is very different from what we saw with COVID and even what we were seeing with RSV previously.
So please forgive my ignorance here, but what's going on here? Why is it that we're seeing these huge numbers in these intensely severe cases? Dr. Bogoch, to you.
Yeah, I don't think we can speak confidently on this. Certainly, there's a lot of different theories floating around. One of them is that over the last couple of years, we haven't really been exposed to the viruses that we're normally exposed to the same degree. So at a population level, we have less population level immunity. That's not to say we want people to get infected. We obviously don't. But suddenly you're getting 2 years worth of infections in a short period of time. That's one theory. Another theory is that COVID can dysregulate our immune systems, and perhaps that might be causing some more of the severe infections that we're seeing right now. I think it's obviously premature to be confident on any of these, but those are a couple of the theories that are floating around.
Interesting. You know, earlier in the show, I was thinking about the item we had in the first block about a hospital in Markham currently struggling with kids, but anticipating a surge in adult hospitalizations. Does this match the modeling you're both seeing? Dr. Bogoch first.
Oh, absolutely. And in fact, we already are starting to see an uptick in the number of people hospitalized with influenza. It's particularly predominant in the age group over 65. But of course, anyone of any age can get this infection. In the adult world, though, typically older individuals and individuals with underlying medical conditions are more at risk of severe infection that bring them into hospital. We've already started to see it. Unfortunately, it's still early in the influenza season, so we'll be seeing a lot more of this as we move forward. I think the key point to parlay is that the vaccine is safe. It's widely available. Anyone over the age of 6 months can get the influenza vaccine. It goes a long way in protecting people from getting the flu. And if you do get the flu, it still goes a long way in keeping people out of hospital.
Okay, so to that point, I mean, you've both strongly made that point, but also made the connection that certainly the vaccination rates amongst kids for the flu, I mean, it's not great. There doesn't seem to be a large uptake amongst adults. Why not? And how do you deal with that, Dr. Kakar?
And I know there's been a lot of vaccine fatigue with COVID, and that's part of it. But another part is that it's just been difficult for people to get those vaccine shots. In Quebec, it wasn't free for all children until just a few weeks ago. And just making the appointments for people who want to get the vaccine is almost impossible. Almost every single person on call with me this past week is in a rush to get their children vaccinated, and the appointments are not easily available, they're not readily available, and that's been an issue.
Dr. Bogoch.
We've got to lower barriers to vaccination, just like we did with the rollout of the COVID-19 vaccine for doses 1 and 2. You need sound communication that's targeted. You need strong community outreach and community engagements, especially with communities that are disproportionately impacted by the flu. And then you need to lower barriers by bringing the vaccine to the people, putting pop-up vaccine clinics into temples, into community centers, into schools, into where people are.
And masks, right? I didn't hear you say masks, but I have a feeling that you're seeing masks as just a given.
Oh, yeah. I mean, listen, we're in respiratory virus season. If you want to prevent the transmission of respiratory viruses, if you want to lower your individual risk of getting a respiratory virus, absolutely. Masking in indoor spaces where we know the vast majority of these viruses are transmitted is a given. And again, there's very few mandates across the country, but people can make the smart decision and put on a mask in an indoor space. It will reduce your risk of getting one of these infections.
Last brief thought to you, Dr. Kakar.
Absolutely. And I think especially in high-risk settings, I look at pharmacies where people are gathered looking for medications and not a single mask to be seen. Hospitals, public transport, these viruses are circulating. And if you're getting very sick right now with a high fever, it's likely influenza. So please wear a mask, stay home, try to protect others around you because there's just so much of this circulating right now.
Thank you both so much. Dr. Fatima Kakar, a pediatric infectious diseases specialist in Montreal, Dr. Isaac Bogosh, infectious disease specialist in Toronto. We appreciate your time.
My pleasure.
Thank you.